Morning. I'm Amy Johnson, extending a welcome from Tri-State Manufacturing Association and Central Minnesota Manufacturers Association. Midwest Manufacturers Association partnered with MPMA and several other organizations to bring you this webinar. We really appreciate that you're taking time from your busy schedule to join us. We know there are many webinars to choose from. Our goal is to provide content that specifically helps answer questions from manufacturers and to provide manufacturing solutions. Today, we welcome you to session 10, featuring a discussion on navigating the constantly changing circumstances. To start us off, I'd like to introduce Ben Cox of Federated Insurance.
Thanks, Amy. I'm Ben Cox with Federated Insurance. We've been a partner with MPMA for a long time and have a great relationship. We work in the commercial insurance with a lot of the manufacturers. So I get the opportunity to introduce Beth Mayat here. I think I got that right. And she's going to give us a presentation on she's from PDR Works, and she's going to present on on-site preventative injury therapy. And pretty excited to hear what Beth has to say. Obviously, from the insurance perspective, we get to see some of the impact of not doing things like this and the claims and things like that come through. So excited to hear what Beth has to say and see that perspective.
Again, my name is Beth Mayat. I'm the program director for PDR Works. Again, I want to reiterate a thank you to MPMA, the CMMA, and Federated Insurance and OECS. Thank you all for joining us today. I'm really happy to be here and talk about prevention of injuries at the workplace. PDR Works, we are a recent new member of MPMA, and we're pretty unique in the group. We bring workplace injury prevention and ergonomics to companies in all different industries throughout the state. We use licensed occupational or physical therapists to go to companies and help employees feel better when they have soreness, and hopefully avoiding that OSHA recordable or work comp claim, and basically just keeping your employees at work and healthy and happy. We do have three options for this, three different service options. We can either have a therapist on site for structured weekly office hours. We also have an on-demand or call us when you need us type model. And we also offer telehealth. But the clinical content of that session is the same, an occupational or physical therapist working directly with an employee who has reported soreness. I have a brief video that I'd like to show, but first I'd like to offer just some storytelling about some of the different types of injuries and employees and companies that we work with, and offer you a little bit of an insight into what this injury prevention session really looks like. The first story I'd like to talk about is a construction company that we work with, and they called us for an on-demand session, which is basically they give us a call or connect with us through our on-site or through our online dashboard and let us know that there's an employee that's sore. This was a young gentleman. He's only 34 years old. He basically bent over to get something up off the ground while working at the job site and had a pretty intense low back soreness. And this happened on a Friday afternoon. I saw him Monday morning. When I worked with him in the construction trailer, he told me, this brought me to my knees, and I'm really, really worried about it. I got kids to feed. This is my job. I just came off furlough. I can't let this ground me. He was real worried about it. So I did an examination with him. I gave him quite a few things to work on at home. I treated him there in the construction trailer. When he first walked in, he was very slow to move. He was very tender. He barely let me touch him. He was so sore. But after we talked and kind of got his anxiety and discomfort down, he was smiling and felt a lot better at the end of the session. When he walked in the trailer, his soreness was an 8 out of 10, which is a pretty high report of soreness. And by the time he left, he was down to about a 5. So he felt comfortable being able to continue to work in accommodated job tasks that his employer had arranged for him. And I sent him home with a lot of homework. Here's what you need to do in the meantime. Taping, heat, ice, all under OSHA first aid, so that he could avoid further soreness, most importantly. He got a lot of support from his foreman on the job, who basically said, hey, we can do a tough job. This is really hard. People do get sore. Here's what I have to do every day when I go home to make sure I don't get hurt, and you'll be okay. So having the reiteration of that message was really helpful to this employee. I saw him 4 days later, and he continued to report improvements. He was continuing to work with accommodated tasks and was definitely on the road to recovery. He was smiling and feeling a lot better at that point. So that's an example of kind of an on-demand session, kind of call us when you need us. The second example I'd like to provide is a telehealth session. Right when COVID started, I had been working with a young woman who had an office position in a architectural firm and basically a desk job. She was drafting, doing a lot of mouse work. She was 5'1", she was a tiny little thing, and she had wrist soreness. And when we started looking at her positioning for her work desk setup, both at home and at her office, we discovered a lot of things that we could work on with just changing how her office was set up, both at home and at work. So we got her a new mouse, we got her a footstool, we taught her some stretches, how to take breaks throughout her day, talked about that wrist, what might be going on. She was able to apply heat and ice and self-administer some soft tissue work, and was able to avoid going to the doctor or the chiropractor, which she was thinking she was headed in that direction. So, and again, we did this all over telehealth. So she was at her home, I was at my home, and we were able to connect in that way. The last brief example I'd like to give is a warehouse employee at one of our on-site contracts. And this gentleman was a material handler and worked on concrete all day long, 10 hours a day, and pushing and pulling items off and on semi-trucks all day. He walked in and said, "Can I see you? My foot's really sore." So we took a look at his foot, we did some stretches. He had a lot of calf tightness in his arch, and mentioned he was on the verge of ordering new shoes. So of course we talked about what to look for in a good shoe and what are some things he might want to do at home and at work to alleviate that soreness. I saw him, which was 2 weeks later. He had purchased some shoes and brought them in to show me. And I watched him walk. We talked about the fit of the shoe, and he was already reporting quite a bit of a reduction in soreness because of what he'd been doing at home and at work. So the shoes were really what put him over the edge, and his soreness completely went away. So those are 3 different examples of telehealth, on demand, and then also a structured weekly contract, and the different types of companies that we work with. We're going to go ahead and show a brief video. It's about 5 minutes long and kind of goes into a little bit more depth as far as what that injury prevention session really looks like, and then the benefits to both the employees and the employer. So I'm going to pass it off to Jaren.
PDR works, workplace injury prevention and ergonomics. Our therapists work with employees who have soreness, so workers can feel better quickly and stay at work. We provide early intervention for musculoskeletal soreness and discomfort through OSHA guidelines for first aid care. We also coach in moving with confidence, instruction in home cares to continue their healing, and work task modifications. For the employer, we reduce recordables, reduce costs for workplace injuries, and increase employee engagement for early reporting. Our injury prevention sessions come in 3 formats. A therapist can come to the workplace for structured weekly office hours, or virtual telehealth appointments, or on-demand in-person visits. All of our visits are with a licensed occupational therapist who's also certified in ergonomics. Early reporting and intervention means that employees can be seen before they see a doctor and may even avoid the need for a doctor's visit. Whatever format you choose, the clinical content of the session is the same: symptom management and an ergonomic screen of the work area. Come on, let's take a peek into what a visit looks like. Our therapist begins the session by discussing with the employee their complaints, any soreness, achiness, discomfort, as well as how long have they had the symptoms, how often do they occur, and any work or home tasks that might be aggravating for them. Their range of motion, strength, general mobility of the employee is also assessed. Finally, a physical assessment of the sore area is also performed by the therapist, who notes any swelling, tenderness, or other physical signs. Throughout the process, our therapists listen with compassion and are able to provide information and care in a non-threatening environment. By providing care at the workplace, employees feel gratitude and increased job satisfaction, as well as decreased fear and anxiety regarding their soreness. Under OSHA guidelines for first aid care, the on-site therapist can provide injury care without a recordable. By providing this care to your employees, you save valuable time and money. Keeping your employees at work keeps your company productive and efficient. Interventions can greatly reduce soreness, discomfort, and tenderness, but they can also reduce that fear and anxiety that may accompany the soreness. All the supplies are included in the program fees, so whatever your employee needs, it's provided to them at no cost to the employee. Coaching and instruction in stretches, home application of heat, ice, tape, and moving with confidence is an important part of empowering the employee to continue to heal at home on their own. Each session includes ergonomics, so employees can keep working safely and avoid further pain or soreness while working. Our therapists are trained in the biopsychosocial model and are skilled communicators and compassionate listeners. We listen to your employees and gain their trust and confidence during the session. The PDR Works Stretch Program is a component of preventing injuries for employees by teaching simple stretches to use throughout the workday in short micro breaks. PDR Works clients are provided with a video link to the Stretch Program to disseminate to all employees, or an in-person training session can be scheduled. Concepts for healthy habits, such as stretching throughout your workday, motion is medicine, and important lifestyle choices are also part of PDR Works. Again, the goal of PDR Works is to keep your employees safe and healthy at home and at work for increased productivity, efficiency, and job satisfaction. Ergonomics brings the injury prevention program to the next level for employee safety, productivity, and matching the workstation to the worker. By watching an employee work, the therapist can observe how the workstation fits the worker, what physical risk factors are noted, and what job modifications can be applied. How do work task requirements and physical demands affect the employee? Can the employee's body mechanics improve to decrease their risk for injury? Or can the workstation be modified to accommodate the employee and provide for increased productivity and efficiency at the same time? A therapist who truly understands the products, tools, equipment, and jobs at your company can be a great asset to reducing workplace injuries and increasing productivity. Ergonomic risk factors can be addressed with the employee during the injury prevention session, and key decision makers are included as well, such as supervisors, other workers, owners, or safety directors. Any recommendations are made as part of a team. Employees are trained in job modifications to reduce the risk of injury while working, and how to self-assess their work pace, body mechanics, and personal risk factors. When a therapist makes recommendations, it's always with the goal of reducing risk for injury, increasing productivity, and increased safety. A team member who understands that products, procedures, environment, and people do not exist in isolation, and a systems approach to ergonomics is key to making improvements. PDR Works offers continued ongoing monitoring and assessment of any ergonomic changes and workplace practices. This continued presence from a medical professional who has the employee's safety and health in mind is a benefit to the employees and to the company. PDR Works, Workplace Injury Prevention and Ergonomics. We work in all industries and locations and can meet your company's unique needs. We can be at your workplace at a schedule that works for your company, a weekly schedule, virtual telehealth appointments, or an on-demand in-person visit. When your employees are safe, healthy, and happy on the job, your company saves valuable time and money. Thank you for your time, and we look forward to working with you.
So hopefully that gives you a little bit more of a picture as far as just seeing exactly what that session looks like and some of the topics that we cover.
Awesome. Well, thank you, Beth, for sharing. That was pretty good, and I liked you touched on a few different things, but a couple of things I took was just looking at the spectrum of different jobs and how it's important you have a desk job or even a job that's maybe more hands-on, but for both equally important. And I think we see that again in the long term and the impact of both the desk and the labor-intensive jobs that come back and then turn into work comp claims. So awesome. Thank you. And now we're gonna turn it over to Tim O'Connor with OECS, and he's going to talk a little bit about their protocols or their recommended protocols, OSHA, and some CDC standards as well. So Tim, look forward to hearing what you have to share.
Awesome. Thanks for the intro, Ben and Beth. Awesome job. Awesome presentation. Very interesting and good information. My name is Tim O'Connor. I work with OECS, OSHA Environmental Compliance Systems. We've been doing OSHA-specific compliance, environmental compliance, mining safety in Minnesota for 27 years now. I'm going to talk to you guys a little bit today about piggyback a little bit on what Beth had mentioned, but I'm out in the field pretty much every day of the week, Monday through Friday, and out on a lot of job sites or in industrial manufacturing facilities conducting workplace safety audits. I've been working a lot and diving pretty deep into what needs to take place for businesses with the current pandemic, and want to make sure everybody's up to speed, knows where to find some of the information, and just kind of evaluate where you're at right now in your place of business, and see if it generates any questions that you may have for me. So if we can move to the next slide, I'll just go over the agenda real quick, talk about impact. I'm going to give you a couple real world examples, some OSHA guidance and enforcement response, and there are they've taken it another level beyond guidance and recommendations. There are now some requirements through the state of Minnesota. OSHA is doing. We'll talk about controls, best practices, and then if we have some time for some Q&A, we'll get to that at the end. Next slide, please. So, one of the things that I do want to talk to you guys about, can you get to the next slide there, Steve? One of the things I want to talk to everybody about while we're here, it comes, is the planning, responding. Everybody's been hearing so much about COVID-19 and what they need to do for their own safety, for their businesses. And I'm going to give you some of those tangibles and some real world best practices that I've seen in a lot of different facilities. But I'm going to tell you, one of the things that I'm seeing is a miss in many places is the communication piece and the training piece. A lot of folks are doing what has been recommended, or what in the state of Minnesota under some current executive orders been told businesses have to do to be quote unquote compliant. And compliance is awesome, but the safety of every individual should be paramount. That's first and foremost. And the miss, as I mentioned, is folks are not doing the training and they're not communicating. You can have a written plan. You can write a policy, stick it on the shelf, and in reality, what good has that done any of your folks, any of your employees? And you're still leaving yourself open for this virus to come into your workplace. So a plan is good. Responding after the fact, not so much. We want to be as proactive to this as we possibly can be. So I've seen some success stories in the field with folks that have been more proactive, conducting training, communicating, and I've seen some ultimate failures in the field with folks that have not done much of anything. Next slide, please. I'm going to show you this. It's a pyramid, hierarchy of control, or a hierarchy of impact and implications on businesses. And I want to kind of get into this as we go through the PowerPoint here today. And you start out with that baseline, the strongest part of the pyramid, right? And things are just going to continue to get weaker as we get to the top, and usually things are going to be a little bit more impactful if we're not doing some of these things. So if I start out and I don't have a plan at all, and I don't have any action, no preparation, more than likely, sooner or later, you are probably going to experience some sick employees. Mathematically, what we're seeing, especially right now, another big spike in cases. Some of that is due to more testing, and that's good, but there is no playbook for COVID-19, folks. There's no black and white, all the right answers. We're all right now in this together, trying to write the playbook and trying to figure out our pathway to get through this and come out on the other side of it. But you are going to see absenteeism, reduced production, lost revenue. It's happened with many employers, furloughs, layoffs. Some folks have shut down. Some folks have just plain gone out of business. And that's the reality of what's going on. And that question mark at the top is, what is the worst case scenario if I'm not building that solid foundation? So the next slide, I'm going to show you, it's a real example of where nobody did nothing. In Grand Forks, and this is not too long ago, this was just a few weeks back. This is a company in Grand Forks, ended up having a very big outbreak of COVID, and the little blurb at the top, nobody did a thing until after there were positive cases. This is a citation from an employee that was interviewed after OSHA came into the facility. The result is, after a few weeks, 145 people in this one facility tested positive, and to date, there's been at least one employee who has died as a direct result from COVID, spread more than likely in the workplace. And we'll get to that a little bit more, because I get the question a lot. Tim, how in the heck do we know that anybody contracted this in our workplace? Well, I'm going to tell you, if you have 0 known cases and out of your one workplace, you end up with something like this instance, 145 people testing positive out of one workplace, I can tell you, you are more than likely going to see your Department of Health and OSHA, be it a state OSHA or federal OSHA, doing some type of investigation into what happened. And that's what we've seen here. Next slide is another example. This one was from about a month ago, I suppose. And this was close to home here in Minnesota, the Amazon down in Shakopee. I don't know if anybody's close to that area, but many of you know who Amazon is, of course, and there is a big distribution and fulfillment center down in Shakopee. And I don't know what the complete outcome was of total cases, but they have about 1,000 employees down there. Boom, just from one day they went to, from no cases to 88, and they were continuing to test, and hey, I again, it doesn't take much. It takes 1 or 2 people, and I'm going to show you some examples later on down here of how the spread occurs mathematically and how quickly it spreads. So just showing you some real world stuff that's happened close to home. There's hundreds of examples out there now, cases out there now in the workplace. So I just want to show you this is really happening. This is happening around here, and it's not going away anytime soon. Next slide. So, some of what we have to talk about, what we have to do is for compliance, guidance, enforcement, response. First and foremost, though, folks, it should be for general safety. And this is where one of the biggest hurdles that I'm seeing and coming across out in the field is taking place. People are saying it's not going to happen here, and if it does, it's like the flu, and we'll get through it. Not everybody is just getting through it. In the workplace, we may have folks that have some of those health conditions that we don't even know about. Maybe HR does. Maybe they haven't even shared them. We have some folks that may be older in our workforce. If we look at the facts, we look at the science, and we look at what's happening, those are some folks who we have to do our best to protect. So we have to pay attention to what we're doing in our facility, how we're minimizing or mitigating potential for this unseen virus to get into our facility, but it is happening. So there are best practices to do. Next slide. And what OSHA is currently doing and what we're seeing out there is, they are going to inspect, they are going to do an investigation if we're seeing some of those examples I shown you earlier, or if somebody calls to complain. Now, not every complaint is met with an on-site facility investigation or inspection. Sometimes OSHA is picking up the phone and they're calling and they're saying, listen, we have received an anonymous complaint or a complaint from an employee, and these are some concerns we have, and then there may be follow-up. So OSHA will investigate complaints, referrals. Obviously, if there are, big outbreaks in a facility, meat packing plants down in southern Minnesota, few people end up passing away from that. Hundreds of people tested positive. OSHA is going to investigate, as well as Minnesota Department of Health. So just to let you guys know, OSHA is back in the field. OSHA is conducting regular safety enforcement investigations and inspections. They are also looking at some COVID compliance while they're in the field or responding to complaints. Next slide. So there is a prioritization of what OSHA is going to look at, and I kind of mentioned that. Some of the fatalities, imminent danger, exposures, they will come out. They are going to take a look at what you have, and one of the things that many people have to have, particularly on construction sites, with the latest executive order, EO 2074 from Governor Walz, is if you are on a construction site and you're a general contractor, you must have a written infectious disease prevention or preparedness policy with some of the COVID specifics. Those are not just recommendations. There are recommendations and best practices, but now with that new executive order, there is must-haves. There are requirements. So OECS has written an infectious disease preparedness plan with specific appendices for both manufacturing and industry and construction sites. So if anybody wants to see any of that, or you have questions, by all means, there's other examples out there, but we've created a pretty lengthy one. Next slide. I want to just bring up some examples to everyone of what OSHA can refer to when it comes to issues with COVID in the workplace and in the workforce. Most of us know what the general duty clause is, and that is OSHA's many times, that is their go-to if it's an unsafe workplace. If OSHA comes out and says, listen, you have employees that are exposed to known hazards here, and I can't cite a specific code, but there are issues, they can always use the general duty clause. Read it, and that's basically what it says. You're not providing a safe workplace for your employees. However, that's not the only one. Look at all the other codes just in the 1910, which is the Code of Federal Regulations for General Industry, and then the 1904. 1904 is CFR, the Code of Federal Regulations for Record Keeping. There are new interim OSHA guidelines for record keeping and reporting of COVID-19. And I'll talk about that a little bit more here. Next slide, please. So in that recording of cases under OSHA's record keeping requirements and these interim guidelines, you do have to record on your OSHA 300 log a positive COVID-19 case. If it's confirmed as COVID-19 and it's work-related as defined in the CFR 1904.5 to be specific, and .7, involves one or more of the general recording criteria set forth in those two that I just mentioned, and COVID is a respiratory illness and should be coded as such. So on the 300 log, there are certain columns that most of you are aware of, and this one has to be recorded under respiratory illness. That's exactly what it is. Next slide, please. So here's the big question I get when I refer to that, and well, Tim, how do I know if it's work related? I get this question a lot. I've heard it a lot, and we got to sit down and we got to say, okay, let's go over what you've been doing, what you've done. Have you had any positive cases? So just a couple bullet points to help you think through, is it work related? Well, it's likely if, go back to that instance at Amazon and the Grand Forks facility in North Dakota. All of a sudden, I didn't have any issues with COVID, and now I have 100-some people who have tested positive that all work in my facility. Good chance, folks, that's work related. Now, how it got in there, we don't know. But the point is, if the spread continues and I now have positive cases and I have people who are now sick, and in the Grand Forks plant instance, a person who had died, they're going to come back and say this is a result. This is a workplace-related illness, and in that instance, a fatality. You can argue till you're blue in the face that what you can't prove that one of my workers brought it in here. Well, somebody did, whether it was a worker, a vendor. The point is, it got into your facility and it spread, and now it's a big issue. If it's contracted shortly after close exposure to a customer or somebody else who has had a confirmed case, more than likely it can be tied into work related, or job duties, having frequent close exposure to the general public in a locality with ongoing transmission, those hotspots. And people, now we're getting into healthcare and stuff like that too, and some of you may be involved in healthcare or clinics, and but there's a lot of other places, fast food places, all of these the gas stations. We got to think of all these folks that we come across every day, or even some of our clients who work in these areas, and they're at a gas station where hundreds of people are in and out every day. Hey, we got to look at that and say, are we protecting our folks, and are we doing our best? If not, and there ends up being a positive case, could be work related. Now, more than likely not work related. It's one worker, and they come into, their vicinity job duties do not include having frequent contact with general public, so on and so forth. Meaning, I have a worker and I have 100-some employees in my facility, or 50-some guys on a construction site, and I got a guy that says, listen, I'm not feeling well. They call in, hopefully they don't show up. I call in. A few days later, they end up testing positive. They call their employer again, hey, I tested positive, so now they're going to be, they're not going to come in for a couple weeks or quarantine. Do we have to record that on the 300 log? Can we say that's work related? No, you don't have to record that, because again, folks are stopping at the grocery store, the gas station, all these other places, So think about the likelihood of it, and if, talk to your employee, the person that tests positive. Have they been somewhere recently? Grad parties, which people are doing again, going out to, your lake places or out on the weekends. Folks, the numbers are increasing. Again, some of that comes with all the additional testing, but the numbers are skyrocketing, especially in certain areas. Next slide, please. All right, so let's talk about some controls, and I'm going to start out. So if you see this reverse pyramid here, okay, or inverted pyramid, usually where we want to start all the time is elimination and substitution. If we can have elimination and substitution of a hazard, that's great. Can we eliminate COVID? No, not right now. Can we substitute it? Let's not substitute it with another virus. All right. So we have to start, we're already a couple levels into this. We have to start with engineering controls and then admin and PPE. So I'm going to go through these next slides, fairly quickly here. So again, if you have questions as I'm going through these, just think about them or jot them down. We can come to them at the end. Next slide. So what are some of the engineering controls? There may not be a ton, okay? It's not always feasible to put in barriers, but in some places we've seen it. We've actually helped, figure out where some barriers are going to go. We've seen some great examples of this. Sometimes just moving or rearranging your areas. It doesn't need to cost the company money. Let's just move some things around. May take a little bit of time and effort, but it's worth it, all right? But physical barriers are great. Moving things around, minimizing numbers of folks in certain areas like your break rooms, lunch rooms, even out on construction sites, when guys are going and they have their little spots that they pick for breaks, lunch. Make sure you're getting out into open air areas. Next slide, please. where there's good ventilation, you know, and we can spread folks apart. Again, when it comes to an engineering control, physical barriers, it's not always easy to implement those. So that's all, you know, there's a few other ideas out there. Those are the couple main ones for engineering controls. Next slide. But what we're going to talk about a little bit more in depth is the administrative controls. And this is where you guys have to really be proactive when it comes to the talking, the training, the communication up and down the chain, the posting of signs, having plans and policies, and then really adhering to them. There are a lot of people that don't like all the stuff that's going on with COVID. I get it. Everybody's heard enough. They've seen enough, but people are starting to get complacent. People are not doing their part where they could be doing a little bit more in the workplace to really minimize potential for exposure. And I'm seeing it. I'm seeing it more and more. We're seeing it on the news. I think, quite frankly, people are getting sick of even watching the news when it comes to COVID. I watch this stuff every night, usually one of my last things at the end of the evening, because I take my notes, and we continue to adopt and adapt different recommendations with different control measures with our infectious disease preparedness policy and what OECS does to implement training and best practices. Next slide. So again, I'll move through these pretty quick because I know I'm you know, getting up there on time. So again, education and training piece needs to be clear, needs to make sure we're promoting you know, those three constants that we know are helping: wearing of face coverings, social distancing, and hand washing, sanitizing. I'm going to come back to those three a few times. If we can keep those as our three solid core foundations, we will help minimize the spread of the virus. It's proven, all right? There's many unknowns, I get it, but some of these things are working, and when we're recording all of these statistics, it's showing to prove positive. Next slide. Make sure that we establish the social distancing by increasing that physical space. I've even seen folks staggering work schedules. I've seen, you know, limited facility access if there are folks that do not need to come in. Even some deliveries, I've seen a lot of differences when it comes to deliveries. Now, folks like our FedEx and you know, UPS and postal workers, they all are doing things to minimize bringing the virus into a facility, and they're doing a great job. But we can have designated areas for drop off when it comes to things, raw materials, office products, whatever it is. We can minimize where people come into our facility. Let's have more of a controlled area so people coming in cannot go all over the workplace. Screening, I'll get to that too. Next slide. We talk about proper hygiene. Make sure you have a lot of access to, you know, alcohol wipes, your sanitizing wipes, wash stations. And listen, you can't do that all day long. I get it. You can't wash and sanitize all day long. So another thing we're telling people to promote, coach, teach is, if I can't sanitize or wash, avoid touching your face until the next time you can. So I go out to a place between I leave work and I don't have sanitizer or wipes in my car, which a lot of people do. People are doing better, but by the time I get home, I've touched the gas pump and I had to go into the store and I didn't have nothing. So don't touch your face. Just when you get home, now wash your hands, sanitize properly, go out now and wipe your steering wheel and everything else. Next slide, please. Encourage use of face coverings. All right, so this is a big one. This is a big pushback. This is one where we get people saying, you are not going to make me wear a mask or coverings. We don't even like to call them masks. All right, who is a face covering protect? It's not protecting the wearer. It's protecting everybody else, helping to protect everybody else by minimizing that spread of sputum, inadvertent cough or sneeze, or some people even when they talk, they have spittle that comes out. One of the most infectious ways that this virus, which spreads like wildfire, is going around is through that that direct sputum, okay? Now, there is talk about potentially the virus can be in a certain area, especially in closed area without good airflow or ventilation for a certain period of time, not proven yet. It is shown, though, that it does stay on surfaces as well. So, but the biggest way that the spread occurs is through that sputum. So wearing a face covering is one of the ways that's helping minimize us if we're asymptomatic or if we don't know, we haven't had the test. It minimizes us spreading the virus. You should want to protect not just your coworkers, but the bigger picture, your family and grandparents and everybody else. Now, we've seen that places, municipalities, states, some governors are saying, some mayors are saying you're going to wear a face covering. And we all know how that's going to go over. But again, please wear it wherever you can. It helps immensely with minimizing the spread. Next slide. Make sure you have implement flexible leave and sick policies. A lot of that is outlined as far as what the state says with you have to let people go and be quarantined, or obviously everybody doesn't want sick employees to have to come into work. We want to encourage them to stay in. Why I bring this up is I've seen places of employment where if you don't come into work, even if you're sick and it's legitimate, that boy, you're going to be made to feel pretty bad, and you're not going to be given many days or many chances. And I know it sounds terrible, but it's realistic and it happens. Especially with this pandemic, please try to be as flexible as possible and let your employees, if they are sick, stay home to recover before coming in and getting tested too, if they can. Next slide. Make sure that we are utilizing health screenings wherever you can. We have health screening forms. I've seen a bunch of them out there, on the internet. Folks, you have to make sure that you're protecting your employees. I've been bringing that up time and time again throughout me talking here. But one of the things you really have to look at protecting too is your workplace, your place of employment, it may be your company. All right. Lawsuits have come out of the spread of COVID. We've seen it. There are examples of it. Many more will probably come out of it in different places. You have to protect yourself. Having documented training, screening forms is a good way to support the fact that you've done something and you are doing something. And in OSHA's eyes, the old school rule is if it's not documented, it didn't happen. So this is another form that helps us document it. Next slide, please. This is just a quick snapshot of an example. Those health screening forms do not need to be lengthy by any means. Just a couple quick yes, no's. And then, hey, listen, you said you've had a fever. You said you've traveled here. We're going to reschedule today. No big deal. People should appreciate that. If there's no issues, boom, approved, and in they go, all right, with some of the guidance of wearing a face covering or whatever your facility is doing. Next slide. Encourage sick employees to stay home, as I said. Make sure that you have good communication with your employees and your folks that are staying home. Next slide. One of the things you want to do is develop or have some type of decision tree for your HR folks, or for folks to say, well, this is the case. There are a lot of different potentials out there for employees to call in, and they're going to say, yes, I feel sick, and this is what's happened lately. Okay, stay home for 72 hours without showing any signs and symptoms, or if you can get tested and you come back and you're negative. There's a bunch of different possibilities here. So have some type of decision tree. And again, OECS has made up a few of these, and we're more than happy to help anybody who would like to see some type of decision tree. Next slide. Implement routine cleaning. This kind of goes without saying. Everybody should be amping up the cleaning a little bit more. The next slide, cleaning and disinfecting the facility if someone is sick. If you have someone who has been sick, shut that area down, okay? It doesn't need to be 24 hours. You can shut it down. It's a good recommendation, but not always feasible. but if you can, shut that area down right away. Do a nice deep clean. If that sick employee or somebody who's just tested sick has been all over the facility, you may need to shut everything down at least for a few hours. Do a deep clean or maybe do it, that evening. The point is though, don't wait. Somebody's tested positive. Don't say, well, let's shut it down this weekend. Don't go a couple days and wait. You need to shut it down immediately, clean and disinfect. All right, next slide. Some best practices, some things I'm going to talk about. Again, this is wrapping back up into the beginning, and we're almost done here, folks. Training and communication is paramount, all right? You can have your policy, you can have your plan. If you're not training, if you're not communicating, and things are changing every day, every week with this pandemic, you're going to be behind the curve, all right? Make sure you're talking to your folks. Everybody's not going to like everything that you're going to implement in the workplace, but you should have some investment of wanting to drive it and steer it in the right direction. Don't let the ship be rudderless out there and just wait to be reactive to an instance, okay, of the pandemic. Next slide. I have a lot of help source information. This checklist thing is a big one. It's on our website, and so we have an infectious disease preparedness policy and a plan. We have COVID-specific appendices. One is the general rules from Minnesota guidelines for opening facilities if you weren't critical infrastructure and you had to reopen. We also have a checklist for manufacturing and industry facilities, and we have just recently created another checklist for construction-specific activities, because there are now not just recommendations, but must-haves for construction. So we have an 8-part checklist for construction where you have to have, as a GC, you have to have a written plan and policy. And if you don't, you can be cited for not having that. That's under EO 2074. Next slide. Make sure, again, wind back into some of these things I've mentioned a few times because they are that important. Practice the social distancing. In the work, folks spread apart, great. If you cannot, and they're elbow to elbow or right across from each other on the manufacturing floor or the shop floor, think about physical barriers, okay? Because we don't want people face to face or elbow to elbow. Again, I'll go back to the meat packing plants and facilities, which now have specific guidance just for those facilities, because there was a number of them that had hundreds of positive cases. They weren't doing the right thing, all right? And in many places, people are still working from home. That's strongly encouraged too. Next slide. Again, just talking about vendor engagement, prohibit non-essential folks from even coming in, have a delivery drop-off area, separate your contractors and vendors from the workforce wherever feasible. And if people do have to come in, make sure you do those assessments and some screening. Next slide. I'm not going to get too deep into this one because it doesn't apply for a lot of folks, I think. But if you do have direct customer engagement in your workforce or based on what you do, try to limit that contact with customers by implementing some type of pickup service, curbside service. Just think outside the box a little bit. Next slide. Travel policies are still very important, okay? So if you have somebody that's going to a hotspot, just getting back, and I'm not talking about traveling outside the U.S. I don't think that's as frequent right now, and the travel is still down quite a bit. But folks are taking their summer vacations and going to areas in the U.S. where the outbreaks have been tremendous. The positive tests, the spikes are tremendous. So, you want to make sure that they're communicating with you. Make that part of your policy. If they return from a place, you may want them to quarantine. All right. Next slide. Conduct, create, respond, ask, offer. This gets back into that important part of communication. Conduct wellness checks, create master schedules for all employees, shows when people may come in contact, basically that contact tracing type thing if you can. Respond with a plan for employees who report or demonstrate, going back to that flow chart. Talk to your employees frequently, okay? you don't need to know all their intimate secrets, but communicate with them right now and offer a variety of solutions for people that may have to miss work or need to be quarantined. Next slide. I'm going to wrap this up by coming back to the very beginning and let you guys know again, communicate, educate, and define or assign responsibilities. Okay, you can have the best plan in the world. If it's sitting on a shelf and you're not talking about it, you're not training on it, you're not checking it, it's probably not going to work very well. Okay, next slide is I do have a resource page where I've got a lot of this information from CDC, Minnesota Department of Labor and Industry, Minnesota Department of Health. And last slide, again, my contact information. I know I went fast through some of this. If you have any specific questions for me, my phone number, my email, or our corporate office, please give us a call anytime, and I believe this is going to be made available to everyone. So again, I know I went a couple minutes over. Ben, I'll turn it back over to you. Thank you.
Awesome. Thanks, Tim. It was a lot of great information. And I know we do have a few questions here. A couple of things I noticed you in the beginning, you kind of came back to it at the end, but talking about kind of the idea of compliance versus general safety and the importance of the reason why we're doing it is the safety of your employees, right? Obviously the compliance part is very important, and you kind of touched on the piece of if you put a plan in place, what good is it if it just sits there? It's not really helping out with the safety of the employees, right? So I thought that was great.
Yeah, and we've seen that. I've seen that personally. My other associates, 20 field folks in the field, have seen it. We've seen the plan that we've given them or that they have, and then we say, do you have the sign-in roster? Well, we didn't train on this. Well, if you're not training on it, you're really not. And yes, taking care of the folks, your employees, that should be number one. But all of this is the path to success to outline the best plan to be proactive versus reactive.
Yeah, no, that's great. And I think there's a couple of questions here. Nancy had one over in the chat side. Do you have any ideas on what to do when employees have traveled recently, even within the U.S., quarantine after coming back, don't allow them to return to work for X number of days? We did that with international travels. Employees couldn't return to work for 14 days, but now we're not sure what to do about U.S. travel.
Yeah, great question, Nancy. So this is our CDC and our guideline, as well as, so you have that decision tree. And going back to that, to answer your question specifically, if somebody travels to Arizona, for instance, where there's a spike right now in cases, and they just went there for vacation, they come back and they are not sick, they're not feeling bad at all, there's no issues. Our best guideline is to still say, when you get home, wait at least 72 hours. 72 hours after coming home, no signs, no symptoms, no headache. Great. If you can get tested, even better. If someone comes back from those hotspot areas or traveling anywhere in the U.S. Where there is a spike in cases, they come back and they say they're not feeling well. Again, get tested. Usually you're not going to be tested until at least a couple days after signs and symptoms, because the incubation period is 2 to 14 days on average. Average time is about 5.5 days for people start showing those signs and symptoms. Get tested. But best practice, Nancy, is if folks come back from those areas and they are not feeling well, until they can come back with a negative test, tell them not to come in for a minimum of 2 weeks.
Awesome. I did get a couple other messages, private messages with questions too. And Beth, there's a question for you, and it's kind of leading to touching on the COVID stuff, but do you see more virtual health being, or the move to virtual health being a permanent change?
That's a great question. I think telehealth is, I don't think telehealth is going to go away, simply because it's a really nice option for whether you're working from home or we're looking at employers that may continue to let employees work from home. Obviously, those employees that are working from home have more of an office job, and I think it would be really interesting for all of us to go around and show what our workstation setup looks like from home. Most of the time, they're not ergonomically correct. There's a lot of options to update. There's a lot of options to modify things. There's a lot of low-cost solutions. So that is something that I think employers are going to have to think about, because as telehealth continues and people work from home, as that continues, we're going to start seeing some sore necks, some wrist issues, some poor seating now becomes a low back problem. At work, people have other people around them to, hey, let's go grab lunch, or let's walk down the hall, or we have a meeting. Versus at home, people tend to sit in their chair all day long and not get up as much. So I think working from home is going to be a new struggle for employers to start to figure out how to deal with those issues for the health of their employees. So yeah, I think it's a great opportunity for companies like PDR Works to really capitalize on that and you know, make sure that those employees at home are still getting good care. Good question.
Perfect. And Tim, there's another one for you. Hospitals should have the best practices and procedures, yet I know nurses that refuse to wear masks. Have you seen adherence as a matter of culture in workplaces?
I see a lot of stuff in the workplaces, some that isn't the best practice whatsoever. I also see some folks not doing what they've even told to be doing, because quite frankly, their answer individually is, I'm sick of this. And again, I'm going to go back to the complacency issue, where we are seeing people that are just completely tired of hearing about COVID, having to be told what to do. And I know that it's a challenge, but when it comes to healthcare facilities, we've done some audits. We've worked with some healthcare places. It's usually mandated that they must be wearing face coverings. Many times they'll be wearing something a little bit better, not just a face covering surgical mask, but an actual filtering face piece for their protection. I'd find that a little bit out of the norm for nurses or anyone in a healthcare facility to not be wearing a face covering, unless that they are not dealing with COVID or not allowing COVID patients or anybody in at all. However, it's still rare that I don't see them not wearing face coverings. But to answer your question on, in a bigger picture, yes, a lot of individuals have it's their decision whether or not to wear it. And a lot of people are choosing to wear face coverings and to do the right thing. In some places, in others, not so much. I live up in northern Minnesota, and just you know, just a quick snapshot of up here. I think the mentality is a little different than if I were in the cities. You know, up here, it don't have as many cases, and we have some counties that still only have a handful of cases. So people are not wearing them that much. But yeah, it's a tough question to answer. I'm seeing a lot of both sides.
Another question, Tim. What have you seen as the top misperception by employers?
The top misconception is how to basically follow that best decision tree or decision guidelines on allowing folks coming back in to the workplace after being ill, and this ties into it, not having the best policy of making sure people are not coming in to say, I'm sick or I may have been exposed. I had an instance at one of my clients where they being the employee, told a worker, oh yeah, I was just at this grad party. This was a few weeks ago over the weekend, and found out that, yeah, somebody there had COVID and a couple other people got it. This person was in work at the workplace telling their coworker this story. You know, there has to be some onus and some ownership on the individual too, on the employees. It's not just all on the employer. Okay, employees, individuals have to be able to communicate. So the communication, the decision tree of what to do if, and then ... because there are a lot of ifs. I'd say that's where people need to do some better work, better training, better education.
Great. Thank you. Thank you, Beth. Thank you, Tim. It was awesome. I know I got a bunch of notes written down here on my end. And thanks, Steve. And Steve, I know you wanted to wrap up here as we finish up.
Yeah, well, thank you very much, Ben, for moderating this. And again, thanks to Beth at PDR Works and Tim O'Connor of OECS. Great presentations. We appreciate everyone joining us today, and look forward to hopefully seeing you all in person soon. And I know both, well, MPMA, Tri-State, and CMMA all have some in-person events coming up, so we'll kind of see how those go, and hopefully we'll all stay safe. But otherwise, hope you all stay safe, stay busy, and look forward to seeing you again soon. Take care.
Thank you.